armamentarium we will be using includes sterile saline, a monojet syringe, silk suture, bone graft material, a membrane, scissors, a needle holder, periosteal elevator, condenser, curette, and your typodont or model. First, fill your monojet syringe with sterile saline solution. We will use a few drops to hydrate our bone graft. While this hydrates, we will go ahead and trim our membrane so that it will fit our extraction site. Make sure it is long enough so that you can tuck the membrane underneath the gingiva. After about 3 minutes, you should notice that the hydrated bone graft has acquired a tacky or starchy consistency. If there is excess solution in the bone graft, just use a gauze pad to soak up the excess solution. Using the curette, begin to place the bone graft material in the socket. For this step, you may need assistance from your partner to transfer the bone graft into the extraction site. Fill the socket with the bone graft to the crest of the bone. After placing the bone graft, we will hydrate the membrane with 1 to 2 drops of saline solution. Once the membrane is hydrated, place the membrane over the extraction site and begin to tuck the edges of the membrane beneath the gingiva. You may also use your partner's assistance for this step. Once the membrane has been properly adapted, you may begin to assemble the suture and the needle holder. Grab the needle of the suture about 3/4 away from the cutting edge. Make sure the needle holder and the suture needle create a 90-degree angle. Begin the figure of 8 suture going from buccal to lingual in the interdental papilla, similar to how we did a single interrupted suture in the oral surgery module. Once you are through to the lingual, you will again go from buccal to lingual in the adjacent papilla. Use your partner's assistance to ensure you are only suturing the gingiva and not the membrane. Once you are through to the lingual side of the adjacent papilla, begin to make your knot close to the suture. Your final suture should have a cross or X shape. Remember to position the knot on the buccal side. Cut the ends of the suture, leaving about 3 mm tails from the knot. Congratulations!